I argue that the way you move your body and the way you position your body on a regular basis impacts the health of your body, and not just the musculoskeletal system, but other systems as well. The way you position your body, of course, we call posture, and that's a controversial word for some reason. Many people think that there's no role of posture in orthopedic disorders, and I'm not one of them. Something they'll say is that, there's not a lot of evidence in the research to support changing someone's posture when it comes to musculoskeletal disorders, but that's not what I find clinically. And I think if you point to the research, you need to kind of comprehend some of the flaws in the research. When I read human studies about posture, I kind of find 4 big areas that I think are lacking when it comes to the quality of the research. For one, I don't think the studies that I've seen are long-term enough. Just like with a dietary example, these changes to the body are usually occurring over years, if not decades. And so a study has to capture that amount of time to really capture the effect of posture long-term on the body. Yes, you could probably have some people that would respond quickly within days or weeks or months, but most times we're looking at years to decades. Secondly, I think postural research lacks controlling for variables, specifically of moving in other or opposite directions of the sustained posture. Just like if you take kind of diet studies, you need to control for those things outside the dietary variable you're looking at. If someone eats a donut every day, but they're otherwise a smoker, and they sit all day, and they eat other junk food, and they never exercise, that's different than someone who eats a donut a day, who exercises, doesn't smoke, loves to walk, eats an otherwise healthy diet. So that's controlling for the variables. To make those groups equal, you would have to make sure that the things outside the intervention or the variable or the specific thing you're looking at are equal. And in posture, I think what you need to do is control for, like I said, movements in other or opposite directions. So if you're looking at the effect of sitting in a slouched low back flexion position all day, you would have to see outside that position, are they just standing? Or are they lying on their side? Are they lying prone? Are they going to yoga class? Are they going to gymnastics class? Do they sleep on their stomach? You have to understand, what are they doing outside of that flexion posture? Because I think the balance of movements throughout the day is what really matters. So if you're doing 8 hours of lumbar flexion or rounding, but you're sleeping on your stomach, which is neutral to mild extension, or you go to yoga class or do some yoga videos at home online and you go into extension every couple days, that's a very different person compared to someone who never does that. The third problem I find with postural studies is that they're too narrow-minded. If we think about the neck posture being in protrusion or flexion for 8 or 10 hours per day looking at devices, we shouldn't just be looking at, does that create neck pain, or even a little bit more broadly, neck disorders, but we need to be looking at, does it create neck disorders or upper extremity disorders or symptoms, because the nerves from the neck go to the upper extremities, and the mechanics of the neck to a certain extent can control the mechanics of the upper extremities. So that's what we need to capture. We need to capture the effect of that position of the neck on the whole upper quadrant of the body. And the same goes for the lumbar spine and the lower extremities. We can't just see if the person develops a low back disorder. We have to see if they develop buttock, hip, thigh, knee, or anywhere below disorders, because that's the influence of the low back on the lower extremities. The thoracic spine would be a little bit more challenging because it can have more varied impacts, but the lumbar spine and the neck, I think we could really understand the influence of those parts of the body on the extremities. Fourthly, you cannot control posture really in a randomized controlled trial that's double-blinded. And a lot of people put that as the pinnacle of research, and if a study does not kind of live up to that expectation or that paradigm of study, of research, then it's not valid. And you just can't. You can't randomize people and put them in a hospital ward and say, you need to sit like this for 5 years and you need to sit like this for 5 years, and blind them to it so they don't know what they're doing and assess the effect. So postural studies, I think, come up against those 4 kind of major issues. For me, as a clinician, I find posture to be very relevant. And like I've said before, a lot of treatment is figuring out what we need to add to someone's life or what we need to subtract from someone's life. For most patients, it's a little bit of both. Let's change how you sit if it's relevant, and let's add some movements in the opposite direction if it's relevant. But it really is a case-by-case basis. So next time you start to think about posture and its role on how your back works, how your knees work, how your neck works, how your hands feel, please just think about these 4 ideas.